Hello, and thank you so much for scanning the QR code to learn more about our project and our poster. We really do appreciate your interest. My name is Julia Johnson, and I, along with my NPD colleague, Cindy Cathcart, have created what we think was a very successful chest tube management class for registered nurses. The title of our project is called Just Breathe, Creating a Multimodal Learning Experience for RNs Performing Chest Tube Management. Just Breathe is not just for the patient, but it's for the flustered nurse who really needed some help in learning how to perform this very important clinical skill. So just a very quick introduction about myself and my colleague Cindy. I am actually here at the conference today, but Cindy could not join us, but she is certainly in spirit. Cindy and I are NPDs at the Medical University Hospital in Charleston, South Carolina. So MUSC Health is a large regional health system with many hospitals throughout our state, but the Charleston division is really the flagship of our regional health system. We're located in beautiful downtown Charleston, and you can see from the map at the bottom of the screen, we have a large footprint downtown. We're very fortunate to live in this beautiful location. There's a picture of myself on the left. I'm Julia, and Cindy has a photograph on the right. Cindy actually recently retired, but again, she is definitely here in spirit, and we had so much fun creating this class together. Cindy and I have fun outside of work as well. As you can see, we attend comedy shows together, and we love dressing up for the 80s because that was when we were young, right? So without any further ado, we're going to talk a little bit about our project. So the problem and the purpose of what we did. So the current state was that our MUSC RNs that were working on adult inpatient units had to manage chest tubes as a part of their scope of nursing practice. However, the opportunities to practice this important skill seemed to come in waves, so either feast or famine. And as a result, the younger nurses and the less experienced nurses, they really did not have a very robust experience with chest tube management. And it was very hit or miss as to whether or not they were working with an experienced nurse on a shift where they happened to have to take care of a patient with a chest tube. As a result, this nursing skill really became low frequency, high risk on many of the med-surg units that Cindy and I covered. As NPDs in MUSC, we are assigned to zones. I had 5 adult medical surgical units to cover as an NPD, and Cindy also had 5. So we teamed up. It only made sense. What we were experiencing was that many of the RNs on the units that we covered really wanted more training, more education, and to really be able to acquire some level of competence with regard to chest tube management. So definitely the gap was trifold: a gap in knowledge, a gap in skills, and a gap in practice. So the desired state was that we were to create a class that included didactic as well as very heavy emphasis on the guided deliberate practice of the management and response to clinical emergencies for patients with chest tubes. What we wanted to create were adult nurses that cared for adults, RNs on adult medical surgical inpatient units that were competent and were providing safe care. And in addition, that these nurses would then support their lesser experienced peers and be able to, after attending the class, bring back with them the knowledge and the education and the confidence so that they could help train their peers. So the evidence that we had that validated this professional practice gap, that we were getting information from a lot of sources, our own direct observation when we were on our units, and staff would, pull us out of our offices and ask us to help them with chest tube management. We had a lot of input from stakeholders when we would do our NPD rounding, just speaking with the nurses on the floor, the nurse managers, and also other subject matter experts. Sometimes it was physicians, sometimes it was nurse practitioners, just from a lot of different sources, that this was definitely something that our nurses needed. They needed more information, more practice, and they needed to develop a level of competency with chest tube management. And again, our own environmental scanning, we typically send out semi-annual educational needs assessments where the staff is able to indicate things that they would like more classes on, and chest tube management was always at the top of the list. So we did have some considerations for planning the course. We realized that we had a diversity of RN learners, just RNs and various levels of nursing experience. We also had nurses that, we covered 3 or 4 generations on our floors. Definitely some differences in gender with regard to the learner types that we had, and then learning style preferences. We had to consider time. There was a lot of planning that went into when to offer these sessions, how to make it something that people would have time to come and really be off the floor and be able to be attentive. We also had to consider the attention span of the adult learner, that they needed time to learn and time to practice. And the other consideration was the learning environment. We really had to think about the number of learners of the class size that would be optimal to give people an opportunity to get the hands on and be able to have these conversations where everyone has an opportunity to ask questions, and it's a little bit more of an intimate setting. We definitely needed physical learning space because we had some needs that we needed the technology and we needed classroom space, but we also needed to be able to mock up a patient room. So actually our learning took place in 2 different settings, and one was a room at one end of the hall and then at the other end of the hall. So there was an opportunity to get up and walk around, which is also good for the learner. We wanted to create a risk-free, safe learning environment where we could have fun, ask questions, and it would be very low stress. We also needed to consider team dynamics to make sure that we created the right tone, that it was a safe place for everyone and there was no judgment. And we were really trying to incorporate social learning, again, knowing that nurses learn from each other, adults learn from each other, and we wanted them to be able to take things away that then they felt comfortable sharing with their peers so that they could continue that education without us. So the design or methodology that we used really honed in on these quotes because as MPDs, we definitely know this to be true as educators, but just to keep this uppermost in our minds, we both really love these quotes. First, there's a Chinese proverb, tell me and I may forget, show me and I may remember, involve me and I understand. And then Benjamin Franklin also is quoted as saying, tell me and I forget, teach me and I remember, involve me and I learn. And with the goal being that these nurses learn and retain what they learned and be able to teach others was really uppermost in our minds. So just leaning on the certain theories, which we're all very familiar with, Malcolm Knowles' theories about andragogy, and then also Kolb's experiential learning cycle, which I have a slide on that in a minute, but really just honing in on our adult learners and understanding their motivation, what's in it for me, readiness to learn, how is it relevant to me, my work, my life. These were elective classes. They were not mandatory. We definitely had motivated learners that signed up for our classes. Also adult experience. So for these nurses, how was what we were going to teach them similar to or different from what they already knew about chest tube management. Also, just respecting their self-direction and giving them resources because many of them were interested in other ways that they could learn more about it, get more practice, have time to reflect. And that was definitely part of the class curriculum. They did have some takeaways, some articles I recommended, and a couple of just paper resources that they did take with them. And also just the orientation. So really incorporating a lot of doing into these classes, knowing that adults need to know how what you're talking about is actually applicable. So really relying on the hands-on piece, these case studies, and they had group activities where they had to solve these problems or these emergencies together, and that's definitely a motivator. That was something that people would definitely requested. They did not want just pure didactic. They didn't want to be lectured to. They wanted to be able to touch and do and understand. So we really strive to create a holistic learning environment, again, leaning on Malcolm Knowles' theories, Cole's cycle of experiential learning, which we're all very familiar with, and then really trying to hit on all three learning domains: cognitive, psychomotor, or kinesthetic, and then the affective or the feeling part of learning, and really how that interconnects with our KSAs, knowledge, skills, and ability or attitude, to create competent nurses, always striving toward a level of competency in chest management. So this was our instructional design, and so this is the agenda. Feel free to stop this recording at any time if you want to look at a slide a little bit longer. I did try to put little gold stars indicating some of the things that I think were novel or innovative with our class. We definitely relied heavily on the hands-on piece because chest tube management requires a lot of devices and things that you have to know how to put them together, or how they're supposed to go together, or how to fix things when they come apart. So we had part of the curriculum included this hands-on exploration of supplies and devices. Actually had chest tubes for them to hold of different sizes to really drive home the point that for the patient, a chest tube is painful. We talked about the closed drainage system and all the different components of the closed drainage system and how all those pieces work together. We did have in the guided deliberate practice section where we had a mocked up patient room. As a group, they had to set up a chest tube closed drainage system together. They had to perform chest tube site care together. And then they had an active team response to adverse situations that we created as the trainers. And here were the different scenarios that we had after they had set everything up correctly and their mannequin patient was safely tucked in the bed. We shooed them out of the room, and then little by little, we created all these different scenarios. And Cindy would play the role of the distressed family member and would go running to the door asking for the nurses to come help. And they had no idea what the emergency was, but they had to respond to that emergency. We would tip over the collection system. We would disconnect the patient from the collection system. We would pull the chest tube out of the patient. We created all of a sudden increase in bubbling in the air leak detector. Sudden absence of titling, we would kink the tubing. We would have the patient complain of sudden shortness of breath. Just a lot of different emergency scenarios, just really trying to stay true to what you see with a real patient on the floor in a busy med-surg floor, so that they could practice their response as a group and just kind of get over the anxiety that comes with, oh my gosh, something's happening to my patient. Do I know what to do to keep them safe? Really focusing again on group problem solving and team learning with these case scenarios, but really trying to add as much realism as we could to the scenario. And I'm going to talk about one thing that we did that really, I think, stepped it up a level. So at the end of all of this fun, we closed the class out with a Jeopardy game. So Cindy and I had created a Jeopardy board with lots of questions, and we divided them into teams. So a little bit of group competition, but it was fun. The prizes were just candy. So we had buzzers and things like that. So really just tried to create a very energetic, comfortable, fun way to reinforce those key concepts, do some knowledge checking, get them involved and engaged, and just set up a little bit of team competition, and all in a very friendly environment. So this was the pre and the post. So prior to class, in class, as soon as they arrive, they get the agenda. They take 5 minutes to do their pre-assessment, again, relying on Patricia Benner's theory of novice to expert. And we explained what the different ratings were. And, this was all anonymous. So the learner would have one side of the paper was the pre-assessment. The other side of the paper was the post-assessment. They were instructed to not put their names on their papers. We just wanted them to be able to gauge their own learning. So they would indicate what they felt like they rated themselves at with all of these different skills, all the different elements of managing a chest tube. This also clues them in a little bit as to what the content is going to be in the class. And then after the Jeopardy game, before they leave, they were to flip the paper over and quickly do their post-assessment, just again to gauge their own learning. And then the third piece of paper was actual review of the content and the speakers. And this is where we extracted the data to know whether or not we were successful in learning. So we did something very innovative, which I think really was part of the success of the class, I think, definitely was making it real with NPD ingenuity. You know that as nurses, give us scissors, give us tape, we are going to make it happen. And as NPDs, we are always on the search for expired supplies and different ways that we can help our RN learners grasp different concepts. So we really did try to make it real. And part of the problem with prior chest tube classes was that you don't actually have a patient, and you don't have this element of realism where you can see an air leak, or you can see bubbling, or you can see titling, or you have a patient that has become disconnected. Everything is just it's just always talking about the closed drainage system, but it's not really tying it to an actual human being, which is the piece that stresses most nurses out. So what I did was actually found I actually found a few of them, old CPR mannequins. This is way before we had, the introduction of the fidelity or the feedback responses on our mannequins. These were just sitting in a closet collecting dust. And the wheels started turning, and I thought, you know what? I think that I can probably do something with these mannequins and make it to where it seems like we've got a patient and they're breathing. So created a medium fidelity mannequin. The NPD can simulate the patient breathing by pushing air in and out of this syringe. This is actually photographs that I took of the mannequins. I made 3 of them. So the chest tube connects to a fully set up closed drainage system. I used colored blue water in the collection system for a water seal, colored red water for the bloody drainage, so that we could talk about measurements, and also to get everything mixed up when we tipped the collection device over in one of our emergency scenarios. So couple of different views. You can see on the lower left hand side, that's a full view. You can see that there's a lot of tubing wrapped around the mannequin's neck for the photograph, and it's attached to a syringe. There's also a chest tube sticking out of the patient's right side. In the center of the screen, you can see that this chest tube actually can come out, and that is black thread that is supposed to simulate the sutures that typically will keep the chest tube in place. The chest tube is in the correct anatomical position, and it can be pulled out by the NPD to simulate the tube falling out of the patient. Also, the tube is very short, and we can separate the tube from the collection device, because that also happens. There's a back view of where the tube exits in the mannequin, and it's a very long piece of suction tubing that I then connected and attached a syringe to, so that I could control the patient, quote unquote, breathing. And that enables me to create titling and create these bubbles in the air leak detector, which were very, very helpful for the nurses to be able to see this happening in real time. So the recipe was NPD vision and determination, always scissors, you know that, a coat hanger, which is actually what I was able to use to snake and kind of cut through the foam in the center of the mannequin and be able to snake this tubing from one end to the other, so that I had an uninterrupted line. Old CPR mannequin, foam filled, again, just collecting dust in the corner of a closet, suction tubing, a lot of it, a 60cc catheter tip syringe, and black thread. So this is a picture of our learners. I did get photo releases signed from all of the people that you see here, but in the top center, you can see that part of the class was in a classroom setting. We had used some videos, and then we've got all kinds of gear. We've got the wet suction chest tube, and then the dry suction chest tube closed collection device. So wet device, dry device, so that we could show them the difference. They did not understand the functionality of the closed drainage system. And so that led to a lot of conversations. I had a little suction set up over there. Again, we had real chest tubes. We just basically broke out all the supplies, and everybody got to touch everything while we talked about it and explained it. The other slides are when we actually went into the mocked up patient room, and you can see the mannequin. We've got the mannequin sitting in the chair. We've got the mannequin in the bed. We've got supplies. There's the chest tube collection device on the floor. And One of the scenarios that you can see in the lower left-hand corner, they were actually having to transfer the patient from the bed to the chair and back again and try to do it without stepping on anything or knocking anything over. So just a lot of fun, and you can see very interactive and a lot of group learning going on and a lot of them supporting each other as they worked through these scenarios and these problems. So the results I have here displayed for you. Some of the results are already on the e-poster, but did ask a lot of questions, again, using those questions from the pre and post, in the moment, after class, and then 6 to 10 months later. So we had a large run of classes. I think we offered 6 or 8 classes in October of 2021, and then we offered 8 classes in April of 2022. So I created one survey, and all the survey was the exact same questions that they had rated themselves on when they actually took the class. What was their comfort level? How would they rate themselves from novice to expert on all the different skills that go into chest tube management? So it was the same identical survey that they had taken post-class, but now we were 6 to 10 months post-class, and what I was doing was testing their retention of what they had learned. I think the class was extraordinarily successful. As you can see, pre-class, just talking about the topic of a purpose of a chest tube insertion, where they rated themselves. Immediately post-class, and then 6 to 10 months later, you can see that their level of expertise had gone up. We did have some people who rated themselves still as novice with, I guess, a little bit less confidence as time went by, but I think overwhelmingly there was a high degree of retention. So I'm just going to go through the rest of the slides very quickly. This was about the purpose of chest tube insertion, pre-class, post-class, and then 6 to 10 months later. The next question was clinical situations that require the use of a chest tube. And you can see just a very high degree of retention. So a great response pre-class, post-class. They definitely learned something in class, but then what we really were looking for was this retention of learning over an extended period of time. 6 to 10 months is a long time, knowing that, again, it is a low volume, high risk event that occurs for nurses to take care of chest tubes. They really do come in spurts. It's not something that they see all the time. So the next question was about the design, function, and features of the chest tube closed drainage system. And they, from going from not really knowing a lot about it to learning a lot and retaining it. So that was very heartwarming. Next question, setting up and prepping a new chest tube collection device. A lot of novices pre-class, immediately post-class, they felt really good about it. 6 to 10 months later, the ones in blue, 16.7% that rated themselves still feeling like they were novice, was simply they had put in the comments that they just had not had the opportunity to put that training into practice. So again, they felt like they really wanted somebody with them the first time they actually did it in real life. Next question, exchanging a full collection device for a new one. Initially, a lot of novices, they learned a lot in class and they remembered it 6 to 10 months later. Chest tube site care. Again, pre-class, some novices, post-class, more experts, and 6 to 10 months later, a lot of retention in learning. For nursing assessment, key focus items for patients with chest tubes. So we went over all the parts of a nursing assessment and what they needed to make sure that they knew and were assessing on their patients. And they, again, we had novices at the beginning. We had a lot of learning that took place post-class, and then a high degree of retention of learning. Obtaining drainage specimen sample from a chest tube. This was something that most of our learners did not know how to do prior to class. Immediately post-class, they felt like they knew what they were doing, and then 6 to 10 months later, a lot of retention of learning. Again, we had gone from pre-class, 77% felt that they were novices. 6 to 10 months later, only 25% still felt like, well, I haven't really done it, so I'm not sure that I can rate myself as anything other than novice. Troubleshooting, how to read the air leak monitor. Pre-class, you can see the results. Immediately post-class, they definitely learned, and 6 to 10 months later, they had a huge retention of learning, which is really encouraging. The next question was troubleshooting, how to find a leak in the system. Again, you can see pre-class, immediately post-class, and a high degree of retention 6 to 10 months later. The next question, understanding titling. So just almost half the class did not really know what that was. After class, they learned, and then they remembered 6 to 10 months later. Next question, understanding suction versus water seal. And you can see pre-class, immediately post-class, and then a high degree of retention of learning 6 to 10 months later. Next question, what to do if the chest tube falls out of the patient? Pre-class, post-class, and then 6 to 10 months later. And again, just feel free to pause this presentation if you really want to take a closer look at the percentages. Next question, what to do if the chest tube disconnects from the closed drainage system? And you can see pre-class, post-class, and immediately, or excuse me, 6 to 10 months post-class, a high degree of retention. So in conclusion, really felt like this was a very well received class, just high marks all around in their own words. I just made a word cloud of all the free text responses that the learners had put immediately post class about how they felt about that learning experience. And then 6 to 10 months later, I did ask the survey participants, how did their nursing practice change as a result of attending this class? And these were the comments from the learners that had attended in October and also October of 2021 and also in April of 2022. They were glad that they had taken the class. They felt like they were competent. They understood how to manage a chest tube. They were able to teach others. They were able to recognize critical clinical complications related to a chest tube and be able to intervene on the patient's behalf. So it's exactly what we had hoped would happen. So outcomes achieved. Our learner outcomes immediately post-class would be that the learners would self-report an increase in knowledge on the management of adult inpatients with chest tubes, that they would know how to set up, manage, and troubleshoot chest tube closed drainage systems. We also wanted them to self-report an intent to apply to clinical practice the new knowledge that they had gained. And then we had learner outcomes for 6 to 12 months post-class. Just one outcome really, that the learners would self-report a retention and application of the knowledge that they had received in the management of patients with chest tubes. So we felt like we had hit the target. So goal achieved. We were wanting to create competent nurses, people that felt comfortable caring for their patients with chest tubes, and that they had such a high degree of comfort and confidence and competence that they would be able to pass this knowledge and expertise in chest tube management onto their less experienced RN peers. It is a circular thing, as you know, in nursing. We are always teaching and learning and teaching and learning. And I really did love this quote from Peter saying, sharing knowledge is not about giving people something or getting something from them. Sharing knowledge occurs when people are genuinely interested in helping one another develop new capacities for action. It is about creating learning processes. And we really do espouse to that. So this is the list of references. Feel free to peruse